See, chair to chair, that's all I can really get. If you want to adjust
So
it.
you want me to adjust it for you?
Yeah, if you, or sit down to close-up, like that's what it is what it is. You put this around your neck so it doesn't get broken, lost, or stolen.
Keep rotating.
Just hit the mute button. And he loaded it before, but I guess she didn't want to disturb the other people.
Oh, nice, you brought this.
How's it going? Can you talk into the mic to see if it's
Test.
Jacob,
try again?
Test.
Did it again?
Test.
There you go. Thanks, good. Slide on it? Do you need your
Actually, I do. It's the line of stuff. That's all. All right, can everyone hear me?
Yeah.
So we're gonna get started now. Thank you everybody for coming out. We're good, all right. To our fourth event here at the Cannabis Cultural Association. As always, a big thank you to the Newman & Farrar Law Firm for hooking us up with this great space to have these type of events. You guys hear me in the back, and yes, that's awesome. So right now, as it stands, the medical program has been in effect in New Jersey for 1,392 days. In New York, it's been in effect for 265 days. Currently, in New Jersey, there are 6,960 patients, and there are 452 registered physicians. In New York, we have 7,627 patients, and we have 692 physicians in the program at the moment. Today's we're going to have a special event and a panel discussion with a New York patient, a New Jersey patient, and we have one of the first certified physicians here in New York also who will be discussing the trials and tribulations of getting your medical card here in New York. You know, the programs are still in their primitive state, and there's a lot of improvement can still be done, and hopefully, just like some of the other states, we'll be adding more elements shortly. But today we also have a special guest from DC. He's one of the leading activists in DC. He's all about the grow and giving away the flower. A mentor, an amazing person, right from when we got started in the game, straight from DC. DC Scriger, please come up and run a few words about your message.
Hello, good evening, everybody. Nelson came down. We met probably about 3 months ago. He's big on hemp also. Coach. I'm big on hemp. So a friend of ours named Coach linked us together. He came down for an event that I did in D.C. In D.C. under Initiative 71, we are allowed to grow. We are allowed to walk out the house with 2 ounces of cannabis on us. We're allowed to gift anybody up to the ounce that is over the age of 21. You don't have to have a medical card in D.C. to partake. I actually follow the law, so I gift ounces of cannabis to people. I gift clones, seeds, edibles. I'm the first DC's edible champ. And rather than feed consumption with my edibles, I did something different, and I chose to give back with a message. Free Treat Fridays. I did Free Treat Fridays throughout the holidays last year, 5,000 plus treats I gave away with a message. Now is the time to educate the masses, to produce, not consume, blue and yellow. Hashtag no bushwhackers. That's a little funny, but what we're talking about is medicine, and bush does not translate to medicine.
Nope.
So I chose to follow Initiative 71. There's nobody in my city that'll tell you I took a dime from them. and I've given away pounds, hundreds of clones, and pure genetic clones, because I believe the plant is a healer. I also have an event coming up, October 14th. I did Cannabis Seeds No Color, which was a citywide, and we had some racial tension in July, kind of like what's going on right now. I did a Cannabis Seeds No Color because our cannabis community in DC actually encompasses the whole of our society. So we chose to put some smiles on people's faces on behalf of Autism Speaks Too. So we collected donations on behalf of Autism Speaks and gave full donations to and raffled off 2 complete grow systems. I'll be doing the same thing October 14th for Cannabis Seeds Purple. We know about the pink ribbons, which is breast cancer awareness, but Lily's talked about the purple ribbons, which is Domestic Violence Awareness Month. So myself, with one of domestic violence champions in DC, Queen Afee, through Domestic Violence Wears Many Tags, we'll be doing the same, giving a citywide free treat, free clone, free seed, free doobies, free wax giveaway, and we'll be bringing awareness to domestic violence. I believe that the plant, we can use the plant for what we need it for as medicine, but we can also promote the plant to bring awareness to others. So thank you guys, that's what I do for my city. Thank you, Nelson, to come up here. There's one more person in this city that's very important that's here today. You guys probably don't know this, but a guy named Jason Beck is here. He's Ash Weedo. It's #1 dispensary in LA, West Hollywood. And he's in town. So after this event, I'll be going to see him because when he comes to DC, I see him. And when I go to California, I see him. You guys might know Dr. Dina. You also might know Snoop. Well, that's the supplier of that chronic that you know for the last 25 years. So I'm more about the grows, real medicine. And I'm glad to be here, and you guys are here to learn about real medicine also.
Now, as we do in our CCA events, we have our first giveaway. Scar, can you come up and help me out with the first giveaway? We're giving away some hemp kettle tea from the Hemp Kettle Key Company. It's run by Mina, another DC native.
Yeah, Mina's great. Hemp kettle tea. I didn't know that you guys had this up here, but because I'm from DC, I guess I'm raffling them off.
Yep.
So
DC Hydroponics.
let me. This is DC Hydroponics, another company of DC.
Did everyone get a raffle ticket when they came?
Everybody got a raffle ticket. I have last number 006. 006.
Whoa!
Wow. There you go. There you go.
All right.
All right.
Right on.
Use the other one?
Yeah, this one is
Oh, that's it?
006.
Okay, all right. And one more tea.
One more tea.
Yes.
All right.
It's hashtag We Are Cannabis Culture.
12. 012. 12.
Anybody? 1, 2? Going once, going twice. How about 0, 1? All right.
012.
Put that back in.
Going
Maybe
once.
somebody's in the bathroom or something.
12. 012.
No?
All right. Next. Ah, 13. Work it.
All right, guys. So we're about to start the panel portion of our discussion in just a moment. DC Scrogger, thank you so much for coming through. He has a show every Friday.
Oh, I forgot about that. I have the first, Nation's Capital's first grow show. It's Scrogging with the Scrogger, featuring Los the Green Thumb, ListenVisionLive.com. It's the largest internet radio show program in the United States. And it's a unique show. We met up.
Awesome.
I met up, I show the grows of the city, and I show all the grows. So all of the grows that you see are not compliant. But because I have the respect of the growers in the city, undisclosed locations.
Thank you so much. Now I'm going to pass off the mic to my fellow co-founder, Christian Jordan, who's going to be leading the discussion today.
Great, thank you. Thank you. I am an attorney here at the law firm. We are a real estate law firm with an emphasis on litigation. So I'm pleased to be here. Thank you so much for coming tonight. We're excited for the program. First, just to give you a sense of what we're going to do tonight, we're going to introduce the panelists, and then we're kind of going to have a casual evening tonight, and I'm going to walk around, and so if anybody has any questions, by all means, feel free to raise your hand, and we'll probably end around 8:30. We'll have a little bit of networking, and then if folks want to move over to a bar, we can do that afterwards. All right? And our panelists will be around for about half an hour after we finish up at 8:30 if you have any questions. Okay, so first we want to introduce Dr. Dara Huang. Dara Huang is a diplomat of the American Board of Internal Medicine. As seen on ABC's The View, Dr. Huang is double board certified physician in internal medicine and nephrology and hypertension. She received her medical degree and master's in medical science from Brown Medical School in 2004, having previously earned dual Bachelor of Arts degrees in East Asian Studies and Biology from Brown University. Her experience in palliative care medicine spanned over a decade when she started her residency in radiation oncology in 2005. Dr. Dara Huang is currently affiliated with Mount Israel, Beth Israel, and Lenox Hill Hospitals in New York City. Manhattan Compassionate Care is the first medical facility in Manhattan qualified to accept patients for the New York State Medical Marijuana Program. Developed by Dr. Huang, the MCC pathway is a comprehensive clinical approach to guide patients from initial evaluation until the date of certification. As one of the first cannabis medicine physicians certified in New York State, Dr. Huang was featured in Crane's New York Business about the scrutiny and barriers facing physicians. As an advocate for medical research and improving access for those eligible for medical cannabis, Dr. Huang strives to add the kindness, awareness, and intelligence she believes the care of all of the patients deserve. Please welcome Dr. Huang. And sitting next to Dr. Huang, we have Mr. Michael Brennan. Michael Brennan is with the Coalition for Medical Marijuana in New Jersey and is a certified medical marijuana patient. Michael Brennan is from Morristown, New Jersey. An accident in November 1981 left him with significant spinal injuries that involve chronic pain, intractable skeletal muscular spasticity, along with several other comorbid symptoms and side effects from conventional treatment. Personal research into therapeutic cannabis began with seeking complementary therapies for those. Michael has given testimony at the New Jersey State Assembly hearings for CUMA, June 4th, 2009, regarding chronic pain and medical marijuana. Medical cannabis. Please welcome Michael Brennan. And last but not least, we have our wonderful supporter and longtime friend, Todd Hinden. Todd is a founder of Panacea Today, and he is a New York State cannabis medical patient. Todd is an activist with over 30 years of experience fighting for people's rights for safe access to medical cannabis. He has also lobbied for the legislation of the cannabis plant and was a former director at High NY. Todd has been a medical cannabis patient for 20 years, previously holding medical cards in California, Michigan, and Colorado. He is currently a New York medical patient using the cannabis to treat his neuropathy rather than using traditional pharmaceuticals. Todd is the founder of Panacea Today, a forum site dedicated to connecting people in the cannabis community to discuss activities and social events involving cannabis. Please welcome Todd. So we thought we'd get started with just hearing a little bit from our patients about their conditions, and then go into how they were able to come up with their cards and thereafter find the medicine. So unfortunately, we only have one mic, and I'm going to be walking with this, so I'll ask you guys to talk a little loud if that's all right. I think that the crowd is small enough we can do that. So Todd, if you wouldn't mind starting us off and just telling us a little bit about your medical condition.
Okay. I actually got injured 40 years ago, but didn't know that I had an injury. And I was working in the audiovisual department of a major corporation here in New York, and a piano actually fell off a truck and landed on me. And I severed my L4 and L5. Unfortunately, at that stage in my life, I never thought about getting medical treatment or getting an MRI. So I worked damaged for 20 years until, I don't know, my goodness, I guess I was around 45, and suddenly woke up one morning and had no control over my body or any feeling below my waist. I was paralyzed, my waist down. So needless to say, I was pretty scared, and went to multiple doctors, went to clinics, went to specialists, nobody could figure out what was going on. You know, pinched nerves were definitely the beginning steps of it. But then when I had an MRI done, they had discovered all this incredible damage between my spinal column, my brain stem, my L4, anyway, the bottom line is I have permanent nerve damage in my spine, neck, and back, and it's at this stage not repairable. So for many years I was taking the pharmacology approach, which was, you know, I don't know how many people, hey, can I ask a question? How many people are taking some form of narcotic or some type of pill? Raise your hand, just show me, please. All right, so a couple of you know what it's like to be on pills. So I was taking very high doses of like, you know, oxycodone and cyclobenzaprine and for the nerve damage and I was having uncontrollable spasms and basically many different drugs. Later, just got fed up with the whole process. Now, mind you, I've been smoking herb for personal use my entire life. Always knew about the medical aspect of it, knew it helped with cancer, knew a lot of things, but until I personally had these injuries, I was like not really pursuing it that way. But then I decided to say, you know what, I don't want to do any of these pharmacology crap anymore, and I decided to take myself off it cold turkey, and from using different cannabis in many different forms and experimenting on myself and talking to other people and visiting other states and experimenting in those other states and just educating myself with the use of cannabis and hemp, actually, too, CBD, I discovered a very nice alternate way of healing myself. And I'll tell you, I'm not looking back. I will never go back to oxycodone or any of those other pharmacopoeia drugs. And that's pretty much where I'm at right now, just self-prescribing and recommending. You know, I started this group 2.5 years ago with this friend of mine, Mike Z, called High and Y. I don't know if anyone here knows about this, but we were basically just trying to get the doctors and the patients together to communicate, because I wasn't alone in this. A lot of my friends, I had a lot of personal friends pass away from cancer and other really bad situations, which I felt if I had only known years ago what I know now, I probably could have reversed a lot of it or even stopped it. And as you know, or maybe you don't know, New York is very, very, very difficult to get a medical card, and the conditions are extremely limited. I feel very sorry for the doctors who are trying so hard to help us, but they're within restrictions because of the guidelines, and it's a really tough battle, which is like, I go to Albany quite often. We try to get the conditions changed, we try to get things added. I've been personally involved with the vets in Staten Island and Brooklyn for the last 2 years, trying to get post-traumatic stress added and just get them their medicine. And like our friend up front row, I work within the gray area too, because out of the need of necessity, I have been forced to make, produce, and exchange medicine, which is not exactly quote-unquote legal. But I'm willing to, you know, look, I don't tell a lot of people this, but I have been to federal prison for what I believe in. I've been arrested for marijuana and cannabis cultivation, but I don't care, because it is just, I have to have my medicine, and until we get it, I'm not going to stop. So.
And Todd, when New York passed the Compassionate Care Act, at what point did you think it was something that you could qualify for?
I knew right away I qualified, but then I went out into the field to try to meet doctors and to try to get my current, well, at the time I was at NYU. The neuropathy had gotten so bad that I was having these uncontrollable Charlie horses in my lower spine and my back, and they were so painful that I couldn't even get out of bed. And of course they just wanted to give me pills, and I was like, no, this isn't going to cut it. So my main care physician refused to even think about doing the medical marijuana or cannabis program. I mean, she's just like, no, I don't want to take the tests, I don't want to deal with the hassles, I don't want to take the time out. I'm here to make money, I'm here to see my patients. So I was like, nice knowing you, goodbye. So it took me almost 6 months to find another doctor who was open-minded.
How did you go about finding a doctor?
Wow. I literally had to call up every doctor in Fidelis Healthcare's book, because that's who my healthcare provider was with. I'm on Medicaid, by the way. And if you're self-insured and have your own insurance, you've got it down. It's much easier that way. But with me, most Fidelis doctors were just like, You want what? No, I don't think so. Click, you know. And I kept just calling through the book until I finally had maybe 20 doctors that were okay. And then I went to visit them.